Every developed country in the world faces the same challenge. How do we provide good healthcare to all our people without going broke? It is a question that leaders from Tokyo to Berlin grapple with every single day. Yet among all these wealthy nations, the United States stands out. We spend far more money on healthcare than anyone else, but our results are often not the best. Americans can face confusing bills, high costs, and a system that can feel impossible to navigate. This has sparked a long and passionate debate across the country about what we are doing wrong and how we can fix it. This debate is not just about numbers on a spreadsheet or policies in Washington. It is about real people and their real lives. It is about a family worrying if they can afford a child's hospital visit, or a senior citizen trying to understand their insurance plan. While Americans are known for their innovation and can-do spirit, our healthcare system often feels like it is working against us, instead of for us. Looking at how other countries handle this same problem is not about saying they are perfect. Instead, it is a way for us to find smart ideas and learn from their successes and their mistakes. Other nations have chosen different paths. Some see healthcare as a right of citizenship, provided by the government like the fire department or public schools. Others have systems that use a mix of private and public insurance, but with much stricter rules and simpler processes than we have in America. These countries prove that it is possible to provide universal healthcare for less money and with less stress for patients and doctors. Their experiences offer a treasure trove of lessons that can help us think differently about our own system. The core question we must ask ourselves is simple. What is the goal of our healthcare system? Is it to create profits for insurance companies and hospital chains, or is it to deliver the best possible health outcomes for every American citizen? By comparing our system to others, we can see that achieving universal, affordable, and high-quality care is not an impossible dream. It is a reality for millions of people around the world. The journey to a better system for America begins with opening our minds to the lessons these other nations can teach us. The American healthcare payment system is a complex patchwork of different players. Most Americans get their health insurance through their jobs, which means private insurance companies are the main payers. For older adults, there is Medicare, a government program. For low-income families, there is Medicaid. And for millions of others, there is no insurance at all. This creates a confusing and unequal system where the care you receive can depend heavily on the type of insurance card you carry in your wallet. It is a system built on thousands of different plans, each with its own rules, deductibles, and co-pays. A major problem within this system is something called fee-for-service. This means that doctors and hospitals get paid for each individual service they provide, every test, every procedure, every office visit. While it sounds straightforward, it creates a powerful incentive to do more, not necessarily to do what is best. If a hospital gets paid more for performing 5 tests than for performing 2, it might be tempted to order more tests, even if they are not medically necessary. This drives up costs for everyone and focuses on the quantity of care rather than the quality of it. This complexity leads to another giant problem: paperwork. Because there are so many different insurance companies with so many different rules, doctors and hospitals have to hire armies of administrative staff just to handle billing and get paid. A huge portion of every healthcare dollar in America goes not to patient care, but to pushing paper. This administrative waste is a heavy burden that makes the system more expensive and less efficient. For patients, it means confusing bills and endless forms. For doctors, it means less time with patients and more time dealing with bureaucracy. Ultimately, the American system often leaves both patients and providers feeling frustrated. Patients are hit with surprise bills and struggle to understand what their insurance actually covers. They are forced to become experts in navigating a system that should be there to help them, not confuse them. Doctors, meanwhile, are buried under administrative tasks and feel pressure from the fee-for-service model. They entered medicine to heal people, but they often spend their days fighting with insurance companies. This is the maze of American healthcare, and it is clear we need to find a better way forward. In the United Kingdom, they have a system called the National Health Service, or NHS. It is simple. The government pays for healthcare for everyone, using money from taxes. When you go to the doctor or hospital in the UK, you do not get a bill. This system makes sure everyone has access to care, regardless of their income or job. The key lesson from the UK is the power of simplicity and universal coverage. By having one single payer, the government, the The system cuts down on administrative waste and ensures that healthcare is treated as a public good, available to all. Germany offers a different model. Germans are required to have health insurance, but they can choose from many different non-profit insurance plans called sickness funds. These funds compete for customers, but they all have to offer a basic set of benefits, and they cannot deny coverage to people with pre-existing conditions. The government sets the prices for medical services, so doctors and hospitals know exactly what they will be paid. The lesson from Germany is that you can have a system with choice and competition, but it works best with strong government rules to ensure fairness and control costs. Our neighbor to the north, Canada, has a system that is often called Medicare for All. Like in the UK, the government is the single payer for doctor and hospital services, funded by taxes. Every Canadian has the same insurance card. This dramatically simplifies billing and paperwork for doctors, allowing them to focus more on patients. Private insurance still exists, but it is for things not covered by the public plan, like prescription drugs or dental care. The lesson from Canada is the immense value of reducing administrative burden, which frees up both time and money for actual patient care. Finally, Japan has a system that achieves excellent health outcomes at a very low cost. Like in Germany, everyone is required to have health insurance, either through their employer or a community-based plan. The government tightly controls the prices for every single medical procedure and prescription drug, negotiating with providers nationwide. This price book is the same for every doctor and every hospital. As a result, the system is predictable and affordable. The great lesson from Japan is the power of transparent and fixed pricing to keep healthcare costs under control for the entire country. American healthcare providers can learn so much from these other countries and start making changes right now. The first big lesson is to move away from the fee-for-service model and embrace value-based care. This means getting paid for how healthy you keep your patients, not for how many tests you run. Providers can form partnerships to manage the health of a whole group of patients, focusing on prevention and chronic disease management. This really aligns the financial incentives with the best health outcomes, rewarding doctors for keeping people well instead of just treating them when they are sick. Another powerful lesson is the importance of simplifying administrative processes. While providers cannot change the whole insurance system overnight, they can work to make their own billing and scheduling simpler for patients. This could mean offering clear upfront price estimates for common procedures or having financial counselors who help patients understand their bills. By making the financial side of care less confusing and stressful, providers can build trust and improve the patient experience. The goal should be to reduce the mountain of paperwork that buries both doctors and patients. Investing more in primary care is a lesson that shines through from nearly every successful healthcare system in the world. In many countries, the primary care doctor or general practitioner is the quarterback of the healthcare team. American providers can strengthen their own primary care practices, making them the first stop for patients. By building long-term relationships with patients, primary care doctors can handle most health issues, coordinate with specialists, and focus on keeping people healthy. This reduces the overuse of expensive emergency rooms and specialists, saving money and improving care. Finally, collaboration and transparency are key. Hospitals and clinics in the same community can learn from each other and work together to improve health outcomes for everyone. This could involve sharing data on quality and costs, or collaborating on public health initiatives. Providers can also be more transparent with patients about the cost and quality of their services. When patients have clear information, they can make better decisions about their care. By working together and being open, American providers can start to fix the system from the ground up, one patient at a time. The path to fixing American healthcare does not require us to simply copy another country's system. We do not need to become Germany or Japan. The United States has its own unique culture, values, and strengths, including a powerful spirit of innovation and some of the best medical researchers and doctors in the world. The real solution lies in creating a uniquely American hybrid model, one that combines the best ideas from abroad with our own homegrown ingenuity. We can build a system that works for our country, reflecting our values while delivering better health for all. Imagine a system that takes the German model of multiple insurance choices, but with strong rules to ensure fairness and affordability for everyone. This would preserve the American preference for choice, while eliminating the worst practices of our current private insurance market. We could couple this with the Japanese model of a transparent, nationally negotiated price list for all medical services. This would bring predictability to costs, allowing both patients and providers to know exactly what to expect. No more surprise bills and no more administrative warfare over payments. From Canada and the United Kingdom, we can learn the incredible value of simplicity and focusing on primary care. By simplifying the billing system and reducing the administrative burden, we could free up billions of dollars and countless hours to be reinvested into actual patient care. By making excellent primary care the foundation of our system, we can focus on prevention and wellness, keeping people healthier in the first place. This is not about government takeovers. It is about making the system smarter, more efficient, and more focused on the patient. This hybrid approach offers a hopeful vision for the future. It is a future where American innovation leads the way in medicine, but our payment system no longer holds us back. It is a system where every citizen has access to affordable, high-quality care, and where doctors are free to focus on healing. The journey will not be easy, and it will require courage and compromise. But by learning from the world and believing in our own capacity for greatness, we can heal our broken healthcare system and build a healthier America for generations to come.